Do topical pain relievers work? General answer is yes. Hi, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice devoted to helping those suffering from chronic pain to go from chronic pain to being pain-free, and using both integrative and holistic approaches. So topical pain relievers do work. They work for acute musculoskeletal pain, but not so much for chronic pain, although sometimes chronic pain, if you have chronic arthritis, sometimes you can have flare-ups, and in those situations of flare-ups, they can be effective. So they are absorbed through the skin, which means that as opposed to a pill that's taken orally, the pill has to first go through the GI tract, get absorbed in through your intestinal organs to get to your bloodstream, and then some of it is going to reach the destined target. With a topical, it doesn't have all of that traveling to do. It just goes through the skin to the area in the muscle or just below the skin layer. And so all of it reaches its target. There are no, or very much less, of the side effects that might be seen with an oral pill. If you have issues with GI or other similar issues, you won't have that with the topical because it's not going through your whole system. What are counter irritants? How do they react? So a counter irritant first gives a cooling effect by stimulating nociceptors. Nociceptors are also known as pain sensing nerve endings. So they first stimulate them and then desensitize them. A benefit of using topicals, as stated, is that it doesn't have to go through the circulation, doesn't have to go through the GI tract. It is used locally, and therefore all of the medication is reaching the target. What are local anesthetics, and how do they numb the area, and how do they block pain signals? So a local anesthetic works by blocking the pain signals that go to the brain. After only a few minutes, pain is blocked, and you should only feel a sense of pressure as opposed to pain in that area. What are some common examples of local anesthetics used in topical pain relief? Lidocaine is commonly used as a local anesthetic. It's used both in over-the-counter products as well as in clinical settings, which it might be injected. Other local anesthetics include bupivacaine, prilocaine, EMLA cream, which can often be used in a clinical setting prior to an injection or into a procedure. It's a combination of both lidocaine and prilocaine. What's the best way to apply topical pain relief products for best results? And are there any considerations to keep in mind? So the topical pain relievers come in many forms. There are creams, there are lotions, ointments, gels, patches. How to know which to use when, it's variable. Some guidelines that might be helpful: if you want it rapidly absorbed and have no residue, to be non-greasy or thin, that would be a lotion. In the setting of dry skin, rashes, skin lesions, of course we're not speaking solely of pain relievers, but just topical products in general. Dry skin, rashes, skin lesions that need protection against moisture loss, you would use a cream because it holds its shape, it's viscous, it's not greasy or to mildly greasy. Ointment is thick, viscous, and greasy. These are topical meds that need maximum product absorption. That's in an ointment. A gel form is used with extremely oily skin. It's thick and it's non-greasy. A balm is very thick and waxy, used with dry skin. Again, this is not necessarily about pain relief, but just if you were using a topical, say, because of dry skin. Dry skin is in need of hydrating barrier and slow absorption. You would use a balm. So this question was asked repeatedly. What are counter irritants? What is their role in topical pain relief? A counter irritant is an agent that produces a superficial irritation in one part of the body that will relieve irritation in another part of the body. So this is commonly known as a chemical stimulation or a chemical stimulation of thermal receptors in the skin, which will cause a sensation of heat or cold. And some popular ingredients found in counter irritants and their effectiveness, that would include things like biofreeze, icy hot. The active ingredient in them would be menthol, which is mint oil. Another one is camphor. Another is methyl salicylate, and also capsaicin. How do topical non-steroidal anti-inflammatories work to relieve pain. Topical NSAID blocks the production of the enzymes of the inflammatory process, thereby reducing pain and swelling. Because there is less NSAID that gets into the bloodstream, there's less risk of the side effects associated with non-steroidal anti-inflammatories. Some of those side effects include elevated blood pressure for some, elevation in blood glucose, or uncontrolled diabetes, kidney issues or kidney damage, GI symptoms. Some people, NSAIDs make them have dyspepsia or stomach upset. So you're bypassing or certainly greatly reducing all of those side effects by using a topical NSAID. Some common examples of topical NSAIDs, and are there any precautions to consider? Very common one is diclofenac, or the brand name might be Voltaren, also Flector patch. Comes in many forms, comes in a lotion, comes in cream, comes in a patch, Flector patch. Topical NSAIDs, as stated, they do have the same side effects as oral NSAIDs, but it's just much less, because much less gets into the bloodstream. And from holistic medicine or homeopathy, a well-studied phytochemical, meaning a chemical coming from plants, believed to also have anti-inflammatory properties and relieve pain and promote healing, is Arnica montana. Another one is Symphytum or comfrey, is used to help with bone healing, and sesamum or Sesamum indicum or sesame. Symphytum must not be taken orally ever. It cannot be used internally. It cannot be applied to broken skin. If ingested, it may cause liver damage. What is capsaicin is another question then. How does it work as a natural pain reliever? Capsaicin comes from cayenne pepper, and it is an anti-inflammatory. Considerations to keep in mind when using capsaicin as a topical pain reliever: it's important that you only use a small amount of capsaicin at a time. If you use too much, it may burn and, obviously cause pain if you're using too much. Some advantages of topical pain relievers over oral medications. So, as stated, we'll state again, when using a topical pain reliever, all of the medication reaches the target, whereas with an oral medication, since it goes throughout the body, only some of the medication reaches the target. And topical pain relievers don't go through the GI tract and will not cause acid reflux or GI upset, as some oral anti-inflammatories may do. And all of the potential side effects of oral medications are much less when used as a topical pain reliever. How do topical pain relievers help manage muscle and joint pain? Due to their counter-irritant effect, topical pain relievers numb the pain of sore muscles, helping them to relax as the stimulus to the contraction, the pain is gone. And due to their anti-inflammatory effect, they reduce pain and swelling in joints. What are some common products that help with this? Any considerations for use? Diclofenac gel 1% or Voltaren gel 1%, applied 1 to 4 times daily or for a couple of weeks to an affected area. Also Biofreeze, which may be applied daily as needed. How do topical pain relievers help manage nerve-related pain? Topical pain relievers manage nerve-related pain, as already explained. What are some common examples of neuropathic conditions that can benefit from a topical pain reliever? I just included carpal tunnel syndrome, cervical radiculopathy or radiculitis, that would be a pinched nerve in the neck. If you're having neck pain, tarsal tunnel syndrome, that's where there's a nerve that's pinched on the medial side of the ankle. And, small joints, hands, pain in the hands, pain at the elbow, pain at the knee, pain at the shoulder, anything that is close to the surface. I have heard of people, I've known of patients that have used it for their back, used it for their hip. These are generally deeper joints, so probably would depend on the body type, but it would not be my recommendation to use it for the back or the hip, because those generally are deeper joints, and the likelihood, if you're trying to reach the joint, the likelihood of that medication being able to help with pain given topically is less. But as I said, I do know of people that maybe apply patches to their back. Perhaps the pain is more superficial and not so much from the bones, that it is effective for them. How do topical treatments help manage pain in the post-op setting? And I really have not heard of topical analgesics used post procedurally. I do know of 𝐜𝐼𝐾 used for some injections, especially in children. So, and that's pretty much all I have to share about that. I hope it's useful to you. If you have not considered using a topical, you want to not have to use pain pills or so many medications all the time by mouth, that is a viable choice for you. I hope you'll give it a try. And also, if you're thinking about looking for a coach, someone to help partner with you in your journey from chronic pain to painless to pain-free, I'm here. You can visit www.chronicpainrescue.com to set up an appointment. You also can set up, if you're on the fence about it, want to talk more about it with me, see if it would be a good choice to work with me, can set up a 30-minute free phone consultation. I am available for that. You could go to social media on my sites. You can set that up as well. If you aren't already aware, on Sunday, July 9th at 3 p.m. Pacific Standard Time, I'm hosting a free chronic pain masterclass. I hope you'll join us. If you or someone you love is suffering from chronic pain, I'm hoping to give you even more information that you can use on your journey to becoming pain-free. Until next time, peace and blessings.